Recognize Mr. Garcia from California for 5 minutes of questions.
Thank you, Chair. Witnesses, I want to thank the chairman and the ranking member of the subcommittee for all their work, and obviously, oftentimes, members on this body and committee disagree. I think that it's important to recognize we lost 1.3 million Americans due to the pandemic, single largest loss of life event that we've had in the modern era. There's over 3,000 people in my own city of Long Beach died while I was the mayor, right before I got to Congress. Horrific experience to see what the pandemic did for cities and communities across the country, and of course the world. I want to note a couple things as this is we're closing this committee. I think one is I'm hoping that there's two critical changes that I think are really important on the federal level, bills that I've been working on. I want to note those for all of you. I'm very concerned that still the Department of Health and Human Services does not have the same emergency buying power that the Department of Defense has. When we went through the pandemic, much of the purchasing of PPE and testing went through DoD because they have emergency power to purchase in bulk and purchase and kind of cut the red tape. That power does not exist for Health and Human Services, where I personally and many others believe is where those purchases and where that direction should be coming from. It should be coming from HHS, not from DoD, or at least it should have the same purchasing power. And so that's something that we're working on. We have a bill on that. The second issue I want to note for members of the committee is we have to get to a point where we fully fund the CDC's National Wastewater Surveillance System. I can't express how important this is in preventing future pandemics. This is woefully underfunded, and we have a huge opportunity to allow and provide the CDC the resources they need to ensure that we are using this incredible resource now and being able to track viruses and pandemics in the future, and that we're funding this at its full level and not actually cutting the CDC and this program. So those are things that are very concerning to me. And I want to say one other thing which I think is important. It's my last opportunity. Dr. Tabak, I know you're with the NIH, and I just wanted you to just briefly mention what the NIH's responsibility is to prevent pandemics, as this committee is working on.
So we support and conduct the research that informs the actions of my colleagues on this panel. We do long-term basic discovery to learn about viruses. We develop key infrastructure so that we can be responsive in identifying newly emergent organisms. We set up appropriate model systems to test the efficacy of potential countermeasures. We have a GMP manufacturing facility.
And Doctor, I would correct to assume that this is a completely nonpartisan organization. The work, it's essential to our nation's security and preparedness. I've met folks that I've worked with at the NIH and immense respect for the scientists, doctors, workers that are there. Would you agree it's completely a nonpartisan type of work?
Yes, we certainly are not.
Then I want to just leave us, as a final thought. I'm very, very concerned that someone that could be entrusted with our nation's health, RFK Jr., has recently said, and I quote, that he plans to have a big role in the administration as it relates to health, and has just days ago pledged to gut the NIH, firing hundreds of scientists and researchers on day one. And I'm going to show, this is from ABC News, the headline that just appeared a few days ago, which, if we're talking about pandemic preparedness, and with all due respect to the committee and the work, the fact that we're considering to bring somebody on with no scientific or medical credentials, who's falsely claimed for decades that vaccines cause autism, who has, quite frankly, said just outrageous comments about science and medicine, that this person would come in to gut the NIH, I think is shameful. I think is shameful. And Ms. Greene, you can clap all you want, but it is shameful, it's dangerous, and if this committee is about pandemic prevention, we should be very concerned as a country that RFK Jr. could be put in charge of health when he is a vaccine denier and has caused great harm to the American public. I want to say just finally that I'm very concerned that someone that wants to gut the NIH, HHS, and other services could be put in charge of health of any kind in this country. And so I want to thank you, sir, for your service at the NIH and for all the witnesses that are here. And with that, I yield back.
I now recognize Mr. Clapp.